Hey again, Debbie Reed here, Think Healthcare Solutions, Trust About Healthcare, and the Healthitude Academy. This is episode 28, Ask a Frustrated Nurse, and this is the one I've been saving for you. I alluded to in my previous video that I had something kind of juicy. This one goes back to and is an outstanding example of what we can do for you, the consumer. This goes way back to 2014. Please, I encourage you to forward this to get people to know what we're all about. This patient back in 2014 had a couple of spine surgeries done at a particular hospital, Centura Health. And I know that I don't think that they're one that is really well, clearly, they're not one that is willing to work with patients, and they're clearly not fair. So, back in 2014, now I don't know if this was emergent. I don't know if, I highly doubt it. I think it's something that, was planned, scheduled, but based on this article, just understand there's a few unknowns that I don't know. But looking at the information, I think it's just a standard. I have back pain. Yeah, the surgery will fix it, and we're going to hook you up. So she has a bill, but it says a pair of spine surgeries, which again could mean they did the big case, and then they might have had to go back for something. I don't think it was two separate events. I think it was during one stay. But that's not the important part. So she has a bill for $229,112. Now, the original bill, the total bill, was $303,709. Originally when I read this, I'm thinking, well, how did they miss this? But apparently, she claims that she signed a contract in which she agreed to pay all charges of the hospital for her care. But St. Anthony estimated it would cost her $1,337 out of pocket, $1,337, and her insurer would cover the rest. Instead, the bill was $303,709. She paid $1,000. Her insurer paid $73,598, and the remainder was the disputed part. Where did I just read that? So, but after surgery, Centura, the hospital group, said it misread Miss French's insurance information and only then discovered she was an out-of-network patient. So Centura then billed Miss French for the $229,112 and sued her for breach of contract to collect. Now, I think that Centura breached by not catching their mistake and not owning their mistake. The insurance clearly paid a substantial amount. I'd like to know what a standard contract is for whatever surgery she had on other providers that would be in network to see what the reimbursement would be. And in all fairness, that's what they should have done. But clearly they went after her for the whole amount, which I think is criminal. I'm just going to say it. That hospital, it's criminal that they sent her to the cleaners for that full balance, because other patients wouldn't have to pay if you were in network, if you had that bill, and let's say the contractual was that they paid $80,000, then maybe they could try and go for the $7,000 because of the out of network. But again, it's the hospital's error, not the patient's. Or better yet, the argument should be with the insurance company, because if this surgery, chances are, was probably pre-authorized, why didn't the insurance company pick up on the fact that the hospital was out of network? If they were doing their job, they should have caught that and said, whoa, do you really want to go to this facility because it's out of network? Even if the facility was oblivious, the insurance should have caught it. So both entities messed up on this account. Not the patient, it's not her fault. Patient goes to the doctor and the doctor says, I do these surgeries, and more times than not, when you're looking at a spine surgeon, they go to the facility that they're most comfortable in and do the most of those complicated cases. And I don't know how complicated. Just because that bill is $300,000 doesn't, based on price of the implants, different things like that. If there was any and what exactly was done, I'd have to have more information. But this, they got, for out of network, I think they got paid fairly well considering. But to send her to the cleaners for the balance, that's crazy. On their mistake. Clearly, it's their mistake. So again, someone like me in your court would be that other voice for you, and we wouldn't be here. Another example is I had a patient. I don't know this person. My son brought me this bill, and it's an ER visit. Standard charges for an ER visit with CAT scan, drugs, labs, different things. It looks like something, chest pain related. Observation. The bill's $13,000. Now the difference here is the insurance company is not paying it, period, because it's out of network. Now I don't know, and I wasn't able to get this information. I don't know if she came by ambulance. I don't know all the other particulars. I do know that particular insurance, Cigna, what was it? I can't remember. Cigna or Blue Cross. They were in network with that facility the prior insurance year. They didn't change insurances, but they clearly changed contracts, and the patient was unaware. So either way, but for the insurance company not to pay anything, I think is chicken. And for the hospital to send the total amount. In my opinion on that, when that kind of stuff happens, it should be at least somewhere on a contractual rate. So in other words, and I'm going to throw this out there because I'm just going to throw it out there. If, for example, you have a $13,000 emergency room bill, which a lot of that is CT scans and the like, the ER level, different things like that. So $13,000 is the charge master amount billed, and let's say your average insurances in network will pay $7, then at least send the patient a bill for $7, not the full amount. I think I really think that's criminal. I don't understand that she had done 2 appeals. Again, I wasn't privy to what the appeals were and how they were done. And for circumstances, this person didn't want to give any more information. She's going out on her third appeal, and I don't see that being a good outcome because of how she's going about it. So it will be interesting, but there's a lot of things, and this is another major reason why having us in your court is a really good idea. And I can't stress that enough. So onward and upward. I took too long on this one. Sorry.